Good afternoon, everyone. Today is World Hypertension Day, and on this occasion, Fortis Healthcare is organizing a mega live session on the topic Understanding Hypertension and Overview. And to participate in the discussion with me are the experts from Fortis Healthcare Hospitals. Number one, Dr. Nishit Chandra. He is Senior Director, Interventional Cardiology at Fortis Escorts Heart Institute, Okhla Road, New Delhi. We have Dr. Shashi Dhara, who is Director Cardiology at Fortis Hospital, BG Road, Bangalore. And shortly, Dr. Podar will be joining us from Fortis Hospital, uh, Hiranandani Fortis Hospital, Vashi. So, to set the ball rolling, let me comment that non-communicable diseases are the leading cause of death today across the globe. Therefore, in year 2011, welcome Dr. Anil. In year 2011, United Nations, they set the goal to reduce mortality or death due to non-communicable diseases by 25% by year 2025. This was called Heart of 25 by 25. The targets which were set was 30% reduction in the usage of tobacco, 25% reduction in the prevalence of hypertension, about 30% reduction in the population consumption of salt, and about 10% reduction in the prevalence of inadequate exercise. So these values themselves indicate how big or what is the quantum of problem at hand. As far as our country is concerned, we have an endemic of high blood pressure or hypertension. And for years, it was believed that hypertension is the disease of rich people, disease of rich countries, and it involves the elderly people. That's not true. In our country, it's more of a myth because the prevalence of hypertension in rural areas and among youngsters, what we call as the premature hypertension, is increasing at a very fast pace. Another point to keep in mind is that the mortality related to hypertension and its complications is much higher among the poor countries of Africa and Asia compared to the rich nations like Europe and North America. To make the things more difficult or more complicated, you see the level of awareness, treatment, and control are very poor in our country. Population-based studies have shown that more than 50% of the residents of India, they have no knowledge about hypertension. 30 to 50% urbanites and 20 to 40% of the ruralites know about hypertension or high blood pressure. And the treatment percentage is also pretty low, 20 to 40% on population-based studies. Those who are known hypertensive, they will take treatment. And with treatment, very few people have adequate control or target control of the blood pressure levels. Only 8 to 15% in the rural areas and nearly 10 to 30% in the urban areas. So that means there is large number of patients who are suffering from hypertension in our country. They are either not taking any treatment or they are taking inadequate treatment for the control of their blood pressure. And all these patients are exposed to the complications or target organ damage due to hypertension. And therefore, day in and day out in our clinical practice, we keep seeing patients who are dying because of these complications like strokes, intracranial hemorrhage, heart attacks, kidney failure. And these are all preventable deaths. With that intent, you see, World Heart Day 2024 has focused on three things. One is the accurate, measurement of blood pressure. Second is control and live long. So the World Hypertension Day 2024 has specifically focused on accurate measurement. As far as measurement is concerned, I'll just give you a brief of the problems involved. One is that the accuracy of the apparatuses. That is very important. We know we have three types of apparatuses. The mercury sphygmomanometer, which is most reliable, and it is very rare that we need to recalibrate it time and again. Second is the aneroid sphygmomanometer, where over a period of time their springs become loose and you have to recalibrate, and recalibration is really difficult. The third are the automated digital monitors, which quite well calculate the mean pressures, but then the systolic pressure is calculated using their own apps, which have their own fallacies. Second is the inter-observer variability. You see the training and the experience and also the knowledge level of the right protocols or right methodology to record the blood pressure or measure the blood pressure is not followed by most of the observers. That's the reason why inter-observer variability is there. And third, of course, we have to be very clear, what kind of environment has to be given to the patient while recording blood pressure, what posture has to be given. Patient should be relaxed, legs should not be crossing each other. So uncrossed legs. So all these factors have to be taken into account. So based upon the theme of World Hypertension Day 2024, we will focus on three things. One is the accurate measurement of blood pressure. Second is the control of blood pressure and how it translates into long life for a patient who is suffering from hypertension. So my first question is to Dr. Nishit Chandra. What is blood pressure? Will you kindly tell our audience in simple words what is blood pressure?
So thank you, Dr. Jaswal, for setting the stage and highlighting the importance of blood pressure. It's becoming the silent killer. And in India, about 220 million people are basically afflicted with this, according to the Fifth National Family Health Survey, which was conducted from 2019 to 21 in 28 states around the India. So blood pressure is nothing but it's the lateral pressure exerted by the flowing blood on the arterial walls. It has two components. One is the pressure exerted during the contraction phase of the heart, which is we call systolic blood pressure, which is the higher reading which you measure. And the second reading is when the heart relaxes, and that is called diastolic reading. That's the lower part. So basically, it's the systolic and diastolic two readings are taken, and both have their own importance. So, in nutshell, basically, blood pressure is the lateral pressure exerted by flowing blood on the arterial walls.
Just an extension of that question, Dr. Nishit Chandra. Why are we so concerned about high pressure in the arteries? How do they harm us? And why the blood pressure should be kept under normal?
So now, high blood pressure, or in medical terms, what we call hypertension. Now, this is one of the most important cause of non-communicable disease and mortality and morbidity around the world. At a given time, 1.4 billion people around the world are suffering from high blood pressure. Now, how does it affect? Basically, as I told you, that it is the pressure of blood flowing inside the artery. Whenever there is a pressure, and if it is sustained for a long time, transient elevations they don't affect, but if it is a sustained blood pressure readings beyond certain levels, which I'll be telling you what is called a hypertension, when we call hypertension, then it starts affecting the target organs. Now, target organs are could be anything. It could be starting with eyes, it could be brain, it could be heart, it could be kidneys. Because blood vessels are everywhere. Every cell requires blood for its nutrition, and they are innervated by the blood vessels. Now, so starting from the eyes, sustained high blood pressure causes hypertensive retinopathy or hemorrhages inside the eyes. Similarly, high blood pressure causes stroke. It could be hemorrhagic stroke or ischemic stroke, most commonly hemorrhagic strokes, if the BP is very high. Then in the heart, it can cause a rupture of the plaque inside the coronary arteries, causing heart attacks, or it can even cause hypertensive heart failure. In the kidneys, it can sustain high blood pressure, which is untreated for a long time, can cause hypertensive chronic kidney disease. So these are basically the few common target organs and very important target organs which are affected by sustained uncontrolled high blood pressure.
Thank you, Dr. Nishit Chandra. You have told our viewers in very simple words, what is the importance of hypertension and what is hypertension. The focus, as I said initially, of World Hypertension Day 2024 is on accurate measurement of blood pressure. So my next question is to Dr. Shashidhara. And my question is that are all blood pressure apparatuses reliable? As I mentioned earlier, the fallacy occurs at three levels. And the first level is the apparatus that we are using. So are all blood pressure apparatuses reliable? How can we ensure accuracy of the blood pressure apparatus? Dr.
Please unmute.
Shashidhara, you need to unmute yourself.
Sorry. Thank you, Dr. Jaswal. Thank you for having me in the program. As you have already alluded to, there are two types of basically blood pressure measuring devices. One is a cuff-based devices, and other one is a non-cuff-based devices. Cuff-based devices, as you already told, we have a gold standard, the mercury sphygmomanometer, which is already is not available because of potential toxicity and environmental concerns. So it is phased out. The other one is aneroid sphygmomanometer, which is the next best thing. But as you told already, there are it requires a frequent calibration. There are issues with inter-observer variability also. The blood pressure measurement can vary between the observers, and with the same operator can have a different blood pressure measurement based on what reading he takes. And the next one is a digital blood pressure monitoring devices, which are now ubiquitous. It is used in ambulatory blood pressure monitoring, in a home blood pressure monitoring, and also office blood pressure monitoring. Nowadays is all done through digital monitorings. The digital monitoring is reasonably reliable, especially as far as the systolic blood pressure is concerned. There may be a slight variability when it measures the diastolic blood pressures, but there are several studies that have shown these differences are not clinically significant. So as of now, I think the digital sphygmomanometers are the devices which are recommended for measuring the blood pressure in the absence of mercury sphygmomanometer. And coming to the non-cuff based BP measuring devices, there are several in the market. They are basically, they measure the blood pressure using the sensors, some various algorithms, and artificial intelligence. And they are embedded in your smartphones, in the pocket devices, and various other wearable devices that have this kind of blood pressure measuring mechanisms. But having said, they are very widely available. But having said that, these devices are not reliable. And as of now, based on the recommendations either by American Heart Association or by European Society of Hypertension, these are not recommended to make a diagnosis or treatment of hypertension using these wearable devices.
Thank you, Dr. Shashidhara. I think Dr. Poddar is still not with us. Dr. Poddar? So I
Yeah, I
think,
can hear you.
yeah, you can hear me. Fine, fine. Sure. So the next question is for you, Dr. Poddar. And this is, what
Yeah,
method is correct to measure? This is very important because, our patients, they come and they come with really, complaints sometimes that the pressure is very high. When we see it in the OPDs, it is very low, because home monitoring is an important aspect also. So for a common man, and also for healthcare professionals, what is the correct method to record the blood pressure?
yeah. The most is yeah. Thank you, Dr. Rakesh, for including me. Now, the most important thing is that the patient has to be relaxed before taking the blood pressure. And as we are, going towards home monitoring or 24-hour blood pressure recording, so that to avoid the white coat hypertension, which is a one-time recording of the blood pressure in front of the doctor, and we are replacing it with home monitoring, which should be included, multiple times, different times, in different situations, so that we get a correct reading. Sometimes in the morning, sometimes in the afternoon, sometimes evening, or even the night, and in a relaxed state as far as possible, in a sitting posture with a with a left hand, and these all devices nowadays are self-recording, and patient has to be very relaxed in that state, keep on or keep a record of all the blood pressure measurements, and then we always judge according to what blood pressure recording we get. And I believe that home monitoring is better than 24-hour blood pressure. 24-hour blood pressure monitoring, one arm gets very sore with the patient, and night also it goes on recording hourly, and that is one of the thing. But sometimes it is needed when situation demands to know that whether it's night time, whether the blood pressure is high or low, and at what time of the day patient has high blood pressure. So these are the things which have, I think, the change which has radical shift which has occurred nowadays in blood pressure monitoring and treatment and diagnosis also, I will say.
That's right. So you have told our patients that, office blood pressure is meant to make the diagnosis. And then home monitoring is something which is very important because it brings out the masked hypertension as well as white coat hypertension. And even at home, they must know how to record blood pressure. Relaxed manner, legs should not be crossed, sitting posture, arm should be at the level of heart, and the Korotkov sounds are heard at the systolic level, and the rate at which you deflate the cuff should be about 2 millimeter per second. So all these precautions, once taken, we get reasonably accurate measurement of blood pressure. Now, my next question is for Dr. Nishit Chandra. Very frequently, patients, they come to us and they say that we won't take medicine because whenever our pressure goes up, we know it because we have headache or giddiness or whatever. Is that true? What are the symptoms of hypertension that we need to watch for?
I'm not able to hear you correctly.
Okay. So I'll repeat my question.
Your voice is
Normally,
breaking.
patients, is it better now? The symptoms of hypertension. Can you hear me now? Is there any issue with the net? Can you hear me, Dr. Nishit? So I think we can ask this question later on. Little later, we'll ask this question to Dr. Nishit Chandra. So we go to the next one to Dr. Shashidhara. What is the harm if BP, which does not cause any symptoms or discomfort to the patient, is left treatment? Why is called silent killer? Dr. Shashidhara, kindly unmute yourself.
Sorry. See, the blood pressure, as we all know, is usually does not produce any symptoms unless the blood pressure is too low or too high. These are the two situations when blood pressure can produce some symptoms. Otherwise, most of the time, when the blood pressure is in the intermediate range, it may not produce any symptoms at all. But the chronically elevated blood pressure over a period of time, as Dr. Nishit already told, it produces the damage on the arterial wall, which supplies blood to the brain, to the eyes, to the heart, to the kidney, to the legs, and ultimately it can produce a stroke. Then patient can have a heart attack, patient can have a heart failure, he can have a atrial fibrillation, he can have kidney failure because of the hypertensive changes, hypertensive effect, and sometimes it can also produce a blockage in the lower limbs and lead to loss of limb also. So, and all these uh, effects of the blood pressure have a significant morbidity and mortality. And unfortunately, sometimes the patient will come to know that he has a blood pressure only after having a complication like a stroke or a heart attack or a
Precisely.
heart failure or a atrial fibrillation. So in that way, that's why it is called as a silent killer. And we should never depend on the symptoms to treat the hypertension.
Yeah, absolutely right. I think there are very few symptoms which can be attributable to hypertension per se. The symptoms normally are attributable to the target organ which is damaged by hypertension. So, am I audible to you, Dr. Nishit Chandra, now? Can I repeat my question now?
Yes, yes.
Yeah, so
Yeah.
the question was, are there any signs or symptoms of hypertension which we need to watch out for? Because as we discussed earlier, most of the patients may come and say that I can recognize when I have blood pressure, my head starts spinning, I have headache, which is a wrong approach to my mind. And we take medicine only when there are any symptoms. So, what signs and symptoms the patients should watch for so that they get alerted and take their treatment regularly instead of pin in pocket kind of approach which many people have.
So I think Dr. Shashidhara has already answered this question that majority of times the blood pressure is having no symptoms at all, and that's the reason it's rightly called a silent killer. So the message to the general public is that if you are an adult, then in any clinic visit, whether whichever specialty you are visiting, you should ensure that the doctor takes your blood pressure, whether she's a gynecologist, ophthalmologist, or any medical encounter you are having with a health professional. You should have a blood pressure recorded. And as you also have rightly mentioned about the correct way of measuring blood pressure is very, very important, because many times we receive a lot of calls that this my machine is gone wrong, and it's sometime it measures higher, sometime it's lower. What should I do? Which machine I should believe in? So, as Dr. Shashidhara has also told the audience that it is very important that we should measure the blood pressure correctly in a correct state. The person should be relaxing, sitting on a chair with back supported, with feet supported on the ground, with the empty bladder, and he should not have smoked or eaten in the last 30 minutes. So, and he should be comfortably sitting with the arms uh, unclothed, usually unclothed. There should not be any clothes over it. And usually there should be three readings, successive readings should be taken and the first reading should be discarded, and the average of the last two should be taken as a blood pressure reading. So this is a very important aspect. Plus, the size of blood pressure cuff is also very important, because improper size also would lead to erroneous readings. Like our small cuff will give rise to higher readings, inappropriately higher readings, while a larger cuff will basically lead to smaller ratings or lower ratings. So while purchasing the blood pressure machine, you should ask the vendor that you should be having the right cuff size. There is usually a guide with the machine that what should be the right cuff size. So this is very important before you start measuring your blood pressure. Now, symptoms are basically the commonest. People attribute that the symptom is headache, but it may or may not happen. If you are having chronic high blood pressure, your body is accustomed to that raised high blood pressure, and you may not have any symptoms at all. Your first symptom could be a stroke, or could be a heart attack, or could be heart failure incidents. So that's the reason of getting your blood pressure measured at every healthcare encounter.
Agreed. So the message to the public is that, you should not wait for the symptoms of hypertension to come, because it's too late by the time you get the symptoms. Hypertension has to be proactively looked for and diagnosed. So my next question is to Dr. Potter. When do you, how do you diagnose hypertension? When would you say that a particular person is hypertensive? Because this is a
Uh,
label that patient is given for the rest of his life. So what are the
yeah.
clinical criteria to
How
diagnose
do you?
hypertension?
Uh, okay. So a person, we should instruct the person that if he's taking a home blood pressure, or if he's coming to us, then the systolic and diastolic, both the readings are important. And systolic going above by some criterias, 120, but around 130 is a systolic, and above 85 diastolic. That's what usually followed. And if some people can have only the upper reading high, that for the public I am just addressing this way, that the systolic is high, and some people can have only the lower one or diastolic high. That can be various aspects of high blood pressure. It may not be high on the both sides. So they should be aware of this. Every yearly they should go for blood pressure checkup, at least if they don't have any other symptoms also. So usually I advise each and every patient to have blood sugar and blood pressure checkup at least once in a year. And you find so many times asymptomatic, as been discussed just now. So they don't have any symptoms, and they just turn out to be hypertensive at some kind of a checkup where they go. So this is yearly checkup is important.
Thank you very much, Dr. Hanif. So my next question is for Dr. Nishit Chandra. You see, as we were discussing earlier also, that majority of the patients who are taking medications for blood pressure, and of course utilizing lifestyle management for control of blood pressure, majority of these patients do not have adequate control of blood pressure. And I was going through some Indian studies where it is mentioned just 8 to 15% of the ruralites and about 10 to 30% of the urbanites have adequately controlled blood pressure. So, how do you define that, yes, this patient's blood pressure is well under control? What targets they should be looking at as far as control? Otherwise, just taking one pill a day doesn't mean that you are controlling it adequately and you are absolved of the complications of hypertension.
So, first of all, I would like here to discuss about the rule of halves. Now, half of the people who have blood pressure actually know that they have blood pressure. Half, other half, they don't know that they are having high blood pressure. Those who
Absolutely.
have that, those who know that they are having high blood pressure, 50% of them, they take medications. And those who take medications, only 50% of them, they are adequately under control. And now the what we call control is now nowadays actually the criteria are very very stringent, and the control adequate control we take is as a systolic less than 120 and diastolic less than 80, according to one of the very popular trial which was conducted, but it's not for the general public. So the high normal, or what we call as 120 to 129 systolic, we can call, and we can give this leeway that up to 129 we can give this some leeway to the patients, and from 80 to 85 diastolic, that's high normal. And so we should basically target that patient should not exceed 130 systolic and 85 or max at the most 90 diastolic. And again, as I have earlier also told you that these should be sustained readings, not not one off reading or one isolated reading. Many times we find people complaining that my blood pressure fluctuates too much. That when should I take it? How if I measure it in the morning, then it is something else. When I measure it in the evening, it is something else. So here comes the importance of ambulatory blood pressure monitoring also, because that gives you a profile of your blood pressure throughout your 24 hours. So if you are having fluctuating blood pressure, which many times what we call whenever you get it measured in the doctor's clinic, usually the blood pressure comes higher, what we call as white coat hypertension. So that's the importance of measuring ambulatory blood pressure monitoring or a home blood pressure monitoring. So the ambulatory blood pressure monitoring is one technique which is now available in India very, very easily, very commonly. Your general physician can guide you how to avail it. And because there are certain patients whose blood pressure rises only during the sleep, or when they visit the doctors, the blood pressure remains all right. That's called masked hypertension. Then, so if we measure the 24 hours blood pressure and make a 24 hours blood pressure profile, we can diagnose certain things, the risk of a future heart attacks or a stroke even earlier, because patients where in the night sleeping blood pressure doesn't dip more than 10%, then that means their parasympathetic or autonomic nervous system is not up to the mark, and these are the patients who are at a high risk of developing strokes or heart attack. In nutshell, for the layperson, it is what I would like to convey is that instead of just isolated measurements in the office or home, you have a technology now where you can have an ambulatory blood pressure monitoring. The way you monitor the ECG, like in a Holter, now we have ABPM monitoring also, and which is very important for decisions regarding when to give the medication, whether you should take the medicine in the morning or whether you should take in the evening. So these things are now available for the general public.
Thank you very much, Dr. Nishit Pindar. Nocturnal surge of blood pressure is very important to note. Very nice point. Now, my next question is to Dr. Shashidhara. You see, patients have a lot of inertia in starting the treatment of hypertension. And most of them would ask you that, can my blood pressure be controlled without medication? Or in other words, what is the non-pharmacological treatment of blood pressure and how successful is that?
Yeah. So definitely, as we know, the blood pressure, hypertension, the diabetes, these are all lifestyle-related diseases. So the lifestyle modification plays a very important role in the management of these diseases, either hypertension or diabetes. And it also depends on what stage of hypertension we diagnose the patient. Suppose it is in the early stage, where there is no evidence of target organ damage, there are no other significant comorbidities, there is always a scope for a lifestyle modification. When we say lifestyle modification, it pertains to his diet, pertains to his physical activity, and of course, maintaining an ideal weight. And of course, if there are secondary causes like apnea or something like that, that addressing those issues also can help one to get the blood pressure under control and probably stay off the medication for some time. But having said these things, the one important thing for a patient once he is diagnosed, labeled as hypertensive, is to be on a regular follow. Just because he is not feeling symptoms doesn't mean anything. So you need to be on a periodic checkup, ensure that his blood pressure is most of the time it is under control. Then only he can probably adopt the lifestyle. Then see if there is in the future, if there is a need arises, probably medication has to be taken. But not all blood pressure patients need medications at the initial stage.
But I think the reverse is also true, that all antihypertensives have to modify their lifestyle.
Yes, yes, yes.
So message is loud and clear that of course lifestyle management is mandatory, but this is not the only thing which can control your blood pressure. Be in contact with your consultant and let him take a decision in your favor. If the blood pressure is not being controlled by lifestyle management, then we have to start medications, and starting medications is much more beneficial than avoiding it. So I think we have lost Dr. Anil Podar. My next question is to Dr. Nikit Chandra. How common is hypertension in Indian population? I think he's already answered that. So I'll like him to focus on women as to how common is hypertension in women and what specific care do women need. And thirdly, pregnancy-induced hypertension.
So, now, according to this fifth family health survey, which was conducted from 2019 to 2021 in 28 states, it was found that 28% of the adult population in India is having high blood pressure. Now, in this, actually 52% of this, they studied actually 19 lakh respondents, and out of that, about 52% were women. And they found that uh, the frequency or the incidence of hypertension in men and women is almost equal. Rather, in women, the problem is that women, they don't seek medical attention very commonly, as commonly as the men. So that's the reason which is reflected. The men numbers are reflected more commonly. But there is not much difference between the prevalence of hypertension as compared to women and men. The message to the general public is that to the ladies is that you also should get your blood pressure checked whenever you visit a healthcare professional. And there are certain conditions which are specific to the women, like pregnancy induced hypertension. So in pregnancy, especially in the first and second trimester, the high blood pressure, because of certain hormonal changes, the blood pressure shoots up, and if it remains uncontrolled, that it can affect the fetal growth adversely. So in every antenatal checkup, you the first thing the gynecologist should measure is your blood pressure. And if the blood pressure is high, now there are very safe methods to reduce blood pressure during the pregnancy. So women also should be very, very cognizant of the fact that they are equally at risk of developing high blood pressure. And during the pregnancy state, you should be very, very careful about your blood pressure, because it will affect your feet baby very adversely. And while you are lactating and breastfeeding the child, you should be aware that there are certain medicines which, if you are taking for high blood pressure, they are secreted in the breast milk. So you should tell your physician that you are feeding the child. So that like ACE inhibitors and ARBs, they should not be taken at that time. So these are the precautions a pregnant lady should, or breastfeeding lady, lactating mother should take.
Thank you very much, Dr. Chandra. You see, the last component of hypertension 2024 day is, live long. So, if a patient of hypertension, once he is labeled, can he lead a normal long life if adequately controlled with the medications and other measures? Dr. Shashidhara.
So if I may answer that,
Okay, sorry. Is it to
yeah,
me? The question is.
you can take
Yeah,
it.
yeah,
You
this
can
is
take
to
it.
you.
Yeah.
Yeah.
See, just because you are labeled a hypertensive doesn't prevent anybody from leading a normal life. But there are certain restrictions. Definitely, he has to follow the dietary advice. He has to follow. He have to take regular medications, and he has to have a regular periodic checkups. And if these things are followed, the patient, if he has not suffered already any significant target organ damage, can lead a normal life as a normal adult or normal person could be. So there is no way that patient, the hypertension will be incapacitated as long as he follows these advices.
So message is loud and clear, if there is no target organ damage. So that means the diagnosis has to be early before the damage is done. And then after diagnosis, the blood pressure has to be adequately controlled to the target values. If you are careful about that, the quality of life as well as the longevity of life will not be compromised.
Yes.
So to conclude, Dr. Nishit Chandra, will you like to give some final message? And what is the
So
your experience
yeah,
about hypertension in your region?
so one final message which I would like to give to the people is that you should be aware of your numbers, and you should not wait for symptoms to occur, and you should get your blood pressure measured. Now the very easily the devices are available nowadays. And one common myth that people uh, have nowadays, that once we start blood pressure medicines, we have to take it for life. So this is again a common myth. If you are controlling your risk factors adequately and you are taking those lifestyle changes which Dr. Shashidhara has enumerated earlier, like if you are overweight, you should control your weight, bring it down. If you are still sedentary, you should exercise. If you are smoking, you should quit. You should moderate your alcohol. If you're doing all these lifestyle changes, then you can even skip these medicines. So this myth, you should actually shatter this myth that once you start on antihypertensive medicine, you should be having all your life. So if you are maintaining a healthy lifestyle, you can quit these medicines. So this is the message which I would like to give to my audience.
Absolutely. Very straight and correct. In fact, it is other way around. If you do not start medications and lifestyle management at the right time, then you definitely end up taking the medicines for the rest of your life. So act early and act wisely. That's the message. So, Dr. Shashidhara, what is your experience with the hypertension in your region, and any message to our listeners which you would like to give?
Yeah, the one of the most like common question or frequently asked question, as Dr. Nishit was telling, most of the patients, they don't want to take any medications. They always want, is there a way I can control my blood pressure without medications? So I always tell them, as long as you follow these lifestyle adjustment suggestions and have a regular checkups, that is very important. People say I am not have any symptoms. I do all those things. I walk, I climb, I do all the physical activity. I don't feel anything. So why should I take medications? So I tell them, as long as you check your blood pressure, check your blood sugar, check your cholesterol, keep them under the target, keep them on the target or under the target. And this should be done periodically, not once in a while whenever you feel some symptoms or anything like that. As long as you do these things, probably, yes, we can probably minimize or even come off the medications. But periodic checkups are very, very vital to all this. That's what I tell these patients who don't want to take medications.
Thank you very much, Dr. Shashidhara, Dr. Nishit Chandra. I think the final message is that measure your blood pressure accurately, act early, go over your rule book, strictly follow the guidelines, and then hypertension is not something which is going to compromise your quality or longevity of life. Thank you very much for joining us. Thank you.
Thank you,
Thank
doctor.
you. Thank you. Thank you.